Hi guys, and welcome to our model on the arterial supply to the lower limb. The arterial supply to the lower limb comprises of a combination of seven main vessels that supplies oxygenated blood to the lower limb. This includes the likes of the superior gluteal artery, the inferior gluteal artery, which mainly supplies the structures of the gluteal region, the femoral artery and obturator artery supplying the thigh, the popliteal artery, and then the anterior tibia and posterior tibia artery that will supply structures below from the legs down to the feet. Let's start with the superior gluteal artery. This is an artery that originates from the internal iliac artery. It is one that is located within the gluteal region and then supplies structures in the gluteal region. For it to gain access into the gluteal region, it would first need to pass through between the lumbosacral trunk and the fascicular nerves. After passing through, it will enter into the gluteal region by passing above the piriformis muscle through the greater sciatic notch. This particular pathway is important to note. As you can see in the picture below, you see the superior gluteal artery passing through that greater sciatic notch above piriformis to gain entry into the gluteal region. Within the gluteal region, it tends to run deep to the gluteus maximus muscle, and it terminates by dividing into deep and superficial branches. Each of these branches will supply structures within the gluteal region. So we have superficial branches of the superior gluteal region as one branch, deep branches being another set of branches, and then the branch that will form the trochanteric anastomosis, which comprises of blood vessels supplying the hip joint, as you can see. So these are all the branches of the superior gluteal artery, branches that supplies the gluteal region, and branches that are contributing to the supply of the hip joint. The second artery on the list would be the inferior gluteal artery. This is also an artery that is gotten from the internal iliac artery. It also supplies the gluteal region but gains access into the gluteal region in a separate way compared to the superior gluteal artery. It passes between the first and second sacral nerve and enters into the gluteal region by passing through the greater sciatic nerve but below piriformis. As you can see in the image below, you can see that superior gluteal artery gains access into the gluteal region by passing above the piriformis muscle through the greater sciatic notch, whereas the inferior gluteal artery passes below piriformis muscle through the greater sciatic filament to enter into the gluteal region. One important thing to note about this artery is its companion, which is the sciatic nerve. Sciatic nerve tends to accompany the inferior gluteal artery as it makes its way into the gluteal region to supply structures there. Once within the gluteal region, the inferior gluteal artery tends to pierce through gluteus maximus and terminates by dividing into multiple branches. It has a muscular branch supplying muscles of the gluteal region. It also forms branches that would give support to the cruciate anastomosis and the trochanteric anastomosis. These are two rich network of blood vessels that supplies the hip joint. You have the cruciate anastomosis around here, and then the trochanteric anastomosis somewhere around here. So moving on to the femoral artery. Femoral artery is gotten from the continuation of the external iliac artery at the inguinal ligament, particularly at the mid-inguinal point. So we usually say that at the inguinal ligament, the external iliac artery ceases from being called external iliac artery, and we replace the name, start calling it the femoral artery. The particular point where that exchange occurs is where we call the mid-inguinal point. We talked about the mid-inguinal point under the model of inguinal region in the abdominal section. From this mid-inguinal point below the inguinal ligament, the femoral artery starts to descend towards the thigh. It enters into the femoral triangle of the thigh, and within the femoral triangle, if you remember, femoral triangle has a number of contents, femoral artery being one. It is related to other contents of the femoral triangle, including femoral vein, femoral nerve, femoral canal. So in the femoral triangle, the femoral artery tends to be accompanied by the femoral vein. So they are very close together and they are wrapped around by a fascia called the femoral sheath. Lateral to the femoral artery is the femoral nerve. Medial to it is the femoral vein. And then the femoral artery keeps descending towards the thigh. Once it gets to the midpoint of the thigh, it leaves the femoral triangle and enters into the adductor canal. It does this by passing through or passing beneath the sartorius muscle. How does the femoral artery end? It ends after passing through the adductor canal by entering into the popliteal fossa. Once it is in the popliteal fossa, we stop to call it the femoral artery and we start calling it the popliteal artery, and that's the termination point of the femoral artery. Let's talk about the branches of the femoral artery. The branches of the femoral artery include superficial branches. deep or what we call profunda femoral artery of deep branches, and then perforating branches. Superficial branches includes the superficial epigastric artery, which ascends all the way up, the superficial circumflex iliac artery, and the superficial external pudendal arteries. These are arteries that are originating from the femoral artery, but not necessarily acting at the thigh. They tend to either move towards the perineum or the abdomen, supplying structures around there. For the profunda brachial artery, profunda femoral artery rather, this is a deep artery of the femoral artery, of the branch of the femoral artery. It gives rise to some minor branches, what we call the medial circumflex and the lateral circumflex. And from our discussion on the joints of the lower limb under the hip joints, remember that the medial and lateral circumflex femoral artery tends to give rise to what we call the cruciate and trochanteric anastomosis supplying the hip joint. Then finally, we have perforating branches of the femoral artery that would form branches supplying the muscles and other structures in the thigh. The second important artery of the thigh is the obturator artery. This is one that originates from the internal iliac, so similar to the superior gluteal and inferior gluteal. The obturator artery also originates from the internal iliac artery. It tends to pass from the or through the obturator foramen, hence the name obturator, and from the obturator foramen it enters into the thigh, accompanied by the obturator nerve. It terminates by bifurcating into an anterior and posterior branch, and that branch supplies structures around the thigh and also structures at the hip joint. So the anterior branch and posterior branch, like I said, are the branches of the obturator artery, and they tend to supply structures within the hip joint and structures within the thigh. The most important branch of the obturator artery comes from the posterior branch, which is what we call the artery to the head of femur. If you remember the artery runs and enters through a ligament into the head of femur at a particular point we call the fovea of the head of the femur, and it gives supply to the head of the femur. If there's a damage to this artery or disruption of blood flow of this artery, it could lead to problems with the head of the femur, and that could cause necrosis, what we call avascular necrosis of the head of femur, which is a very important clinical significance. Another part of the posterior branch is what we call the acetabular branch. This gives rise to blood supply to the acetabulum of the hip joint. Remember that the femoral artery terminates at the popliteal region to form the popliteal artery. Hence, the popliteal artery is a continuation of the femoral artery as shown. It begins at the exit of the adductor hiatus and ends or continues by passing through the popliteal fossa. So popliteal artery is found largely in the popliteal fossa. It's found deep in the popliteal fossa. We usually say it's the deepest structure there, and it's related to other structures there like the popliteal vein and the sciatic nerve. So you could see in the picture below, you have the popliteal artery, we have the sciatic nerve, and we have the popliteal vein. In terms of relation, the popliteal artery is deepest in terms of relation to others, followed by the popliteal vein, then followed by the sciatic nerve and its bifurcation. Popliteal artery tends to terminate by bifurcating into two smaller arteries. This would be the anterior and posterior tibial artery that we'll talk about next. Before it does so, it tends to descend beneath the fibrous arc of the soleus muscle and then terminates by dividing into those two arteries. So what are the branches of the popliteal artery? This includes the muscular branch. Muscular branch would be the artery supplying muscles around the back of the knee, the sural branch, and then what we call the genicular branches of the popliteal artery. This includes the medial and lateral genicular arteries, the middle genicular arteries, and the medial and lateral inferior genicular arteries. These are basically arteries that will give rich anastomotic network to the knee joint. Let's talk about the anterior tibial artery. This is an artery that is arising from as a termination of the popliteal artery. Remember that the popliteal artery bifurcates into anterior and posterior tibial artery. The anterior tibial artery tends to descend anterior to the interosseous membrane, and it enters into the anterior compartment of the leg as a result. It passes midway, it descends down the leg towards the ankle, and then at the ankle, it passes midway between the malleoli and between malleoli, that's the lateral and medial malleoli, to enter into the ankle joint and eventually into the feet. The anterior tibial artery tends to terminate at the ankle by becoming what we call the dorsalis pedis artery. As you can see, this is the anterior tibial artery found in the anterior compartment of the leg, descending down towards the ankle. At the ankle, it is running in between the medial and lateral malleolus, as you can see, and then It passes through the ankle joint to enter into the feet. At the feet, it becomes what we call the dorsalis pedis artery, which is the artery I'm outlining here. Other branches of the anterior tibial artery, they include the anterior tibial recurrent artery that tends to give supply to the knee joint superiorly, muscular branches that supplies muscles of the anterior compartment of the leg, and then malleolar branches that gives rise to supply to the ankle joint at the malleolar region. Posterior tibial artery is the second artery gotten from the popliteal artery. It is an artery that will descend posterior to the interosseous membrane, hence the name posterior tibial, and it runs down the back of the leg, the calf of the leg, towards the knee, the ankle joint. So it passes behind the medial malleoli to enter into the ankle joint. This is contrast to what we see in terms of the anterior tibia. Anterior tibia is passing between the two malleoli, between the lateral and medial malleoli. But in the case of the posterior tibia artery, it passes behind the medial malleoli to enter into the ankle. At the ankle, the posterior tibial artery tends to terminate by dividing into medial and lateral plantar arteries, and this would eventually give rise to supply to the sole of the foot. Prior to its termination, posterior tibial artery tends to form a number of branches. It forms the peroneal artery. Peroneal artery tends to enter into the lateral compartment of the thigh and supply structures in the lateral compartment of the leg rather. Muscular branch would supply muscles of the posterior compartment of the leg, and then finally the malleolar branch would give supply to the ankle joint, also around the malleolar region. And that concludes our module on the arterial supply to the lower limb.